Hello everyone, this is Dr. Nikhil Agarwal. I am Director of Gastrointestinal Oncosurgery at Max Super Speciality Hospital Saket in New Delhi. In this video, we will discuss symptom, diagnosis and staging of esophageal cancer. Like most of our gastrointestinal cancers, esophageal cancer is also asymptomatic in early stages. But as it grows, it can cause symptoms. You should be aware of the symptoms because symptoms are a way of our body telling that something is wrong. The symptoms of esophageal cancer are difficulty in swallowing or feeling of food getting stuck. We call it dysphagia. Unintentional weight loss, pain or discomfort in chest, worsening of heartburn or indigestion, and change in voice. Once we suspect esophageal cancer in a patient, we do tests to diagnose and stage cancer. To diagnose esophageal cancer, we do a test called upper GI endoscopy. This is a procedure in which a thin tube with camera views the esophagus from inside, and if we see any abnormality, we take a small sample which is called as biopsy. Biopsy is then examined under a microscope which confirms the diagnosis of esophageal cancer. After we have made the diagnosis of esophageal cancer, the next step is determining the extent of the disease. This process we call it staging. Staging is very crucial for planning the appropriate treatment and also defining the outcome of treatment. Cancer cells can spread locally through the layers of the esophagus to the nearby lymph nodes and to distant organs like liver, lungs, bone. This is known as metastasis. To stage esophageal cancer, we do some tests like PET-CT scan. In this, a special sugar-like substance is injected which is attracted to cancer cells. The PET scanner then detects this substance and take pictures which is then combined with CT scan images and we get to know the stage of the disease. PET-CT scan will give us an accurate idea of the extent of the disease, whether the disease is limited to the esophagus or it has gone into the nearby lymph nodes or it has gone to other parts of the body. Sometimes we do additional tests like endoscopic ultrasound and bronchoscopy to further understand the stage of the disease. We also use a TNM system to understand the stage of the disease. The TNM system is based on three key factors, which are tumor size, which is T. It means how much the cancer has grown into the walls of the esophagus. Lymph nodes, which is N. Has the cancer spread to nearby lymph nodes and how many lymph nodes? And M, which is metastasis. Has the cancer spread to distant organs like the liver, lungs, or bones? By evaluating these factors, we give these cancers a stage which is TNM stage, and based on this, we put them into a stage which spans from 1 to 4, and it helps us choose the best treatment and the likely outcome. Understanding symptoms helps us diagnose diseases earlier, and early diagnosis saves lives. Stay alert, stay healthy.